Doctor, many women hear about fibroids but don't really understand them. What exactly uterine fibroids?
Uterine fibroids are basically non-cancerous growths of the uterus. They usually arise from the uterine muscles and they can vary in various numbers and sizes. So they are benign growth and usually they are on various surfaces of the uterus, either on the outer surface of the uterus or inside the uterine musculature or on the inner surface of the uterus.
What are the signs that someone might have fibroids?
Okay, uterine fibroids can cause various signs and symptoms. The most common is usually heavy and painful periods. So this is one of the most common symptoms which patients usually face when they are having uterine fibroids. Other than this, some patients, they might have some pressure symptoms. If the size of the uterine fibroid is very big, so they can cause various pressure symptoms like heaviness in abdomen. If they are pressing the urinary bladder, they might have some urinary frequencies, and if they're pressing on the back, so some patients have chronic backache when they are having fibroids.
Okay. Um, are fibroids dangerous?
No, usually they are not dangerous, but they can be debilitating for the quality of life for that particular female if they are causing various symptoms like painful periods, heavy periods, chronic backache, chronic pain in abdomen, and some patients have fertility issues also.
Oh, so they can affect fertility. Can you elaborate on that, ma'am, please?
Yes. If it depends on the number of fibroids, the size of fibroids, and the site of the fibroids. Yes, some fibroids can create fertility issues in the females, either in the form of recurrent miscarriages or inability to conceive.
Okay. And uh, how, how, how can fibroid grow very large?
Yes, if fibroids, they have been undetected for a long period of time and they have been there for a long period of time. So basically they are benign, slow growing tumors. So they can grow to various sizes. Like they have been examples of fibroid growing so much of size, like the bucket full of size. So like patient was unable to sleep also. So that is how big they can grow without causing any symptoms.
Okay. And do fibroids always need surgery or they can be they heal in that?
Yes, it's a very good question, actually. I have seen patients coming with one ultrasound report of a very small fibroids, and they have that fret over that ultrasound report for few days. And then by the time they have come to me, they had several sleepless nights over that ultrasound report. But not all the fibroids need any surgery or any treatment. If it is very small and if it is not giving you any trouble, you don't need treatment for those fibroids just because it has come in the ultrasound report. But yes, it needs constant monitoring and like gradual ultrasound examinations and just to see whether it is growing in size or not.
Okay. And is it possible to prevent fibroids?
No, actually, no. This is one of the most common questions which are being asked. Doctor, what can I do to prevent it from growing in size or prevent it further from coming? There's nothing which we can do to prevent fibroid from growing in size or from coming or recurring it again. So actually, it just happens.
So, any kind of lifestyle changes or anything, they don't work?
Sometimes it works. It will just help you in your painful periods and something like that. But actually speaking, good lifestyle is always helpful for a lot of other things. But for fibroids, I don't think it has anything to do with your lifestyle.
Okay. And do fibroids stop growing after menopause?
Yes, fibroids stop growing after menopause. Actually, they shrink in size. But there's one very big catch over here. If a patient is already having, say, 7 centimeter big fibroid, so how much it will shrink? It will not shrink up to a certain, like not less than 3 centimeter or 4 centimeter. It will still be there. So you will be needing constant monitoring of those fibroids, even after menopause also. If it gives you any trouble in the form of any postmenopausal bleeding or heaviness in abdomen, then yes, you need treatment of those fibroids even after menopause.
Okay. And how are they exactly detected?
The most common means by they, which are, if you visit a gynecologist, she will do your examination. So most of the time it gets detected by general normal gynecological examinations. But the usual method of investigation in to detect fibroid is ultrasound. In some cases, we need MRI also, because if the fibroids are too big and if they are too much number in too much in numbers, and if we are planning any surgery, so then in those cases we need MRI abdomen also.
Okay. And can they come after treatment?
Yes, fibroids can recur after treatment, or even after treatment, if there are some very small, tiny fibroids which we have not been able to detect earlier with any means of investigation or with any means of ultrasound. So then, yes, they can grow in size and then later on they can be detected. So fibroids can grow till the time you're not having your menopause. You can have fibroids and you can, like small fibroids can grow in size.
Right. That's why regular follow-up is what is important.
Yes, regular follow-ups, regular scans are very important in all the females. That is why.
Um, and finally, doctor, what message would you like to give women about fibroids?
Okay. So if you're suffering from heavy periods and painful periods or heaviness in abdomen, chronic backache, which is not resolving with any exercise, and in like if you have visited your orthopedician, if there is no orthopedic causes for your backache, so always visit your gynecologist and try to rule out gynecological causes for these symptoms. So some of the common reasons for these symptoms, one of the common reasons of these symptoms is fibroid uterus. So early detection can help in preventing you from surgery, from a major surgery. We can like save the uterus if the fibroid is detected early, because even a lot of times if the fibroid is very small, but it can give a lot of problem to the patients, because not only the size of fibroid matters, the site of fibroid also matters. So if it is at a site where which it can give you problem like heavy bleeding or painful periods, so then it can be treated without any surgery with the help of medications or some non-surgical methods. So if early detection can help saving the uterus.
Thank you, doctor, for sharing such valuable insights on uterine fiber. Thank you. Thank you so much.
Thank you.